Hi, we're here at the Washington Post with former Secretary of Homeland Security Janet Napolitano, who last summer was named to be the president of the University of California system, which is the largest public university system in the country. And she's here now in Washington to talk to us a little bit about higher education. Ms. Napolitano, thank you for coming to meet with us. Can you tell me a little bit about what you've learned in your first couple of months on the job as the head of UC system, and maybe how your prior job at DHS relates to what you're doing now?
Well, we're the largest public research university. I want to put that qualifier in there. We have the academic mission, preparing the next generation of undergrads and graduate students and PhDs, but we also conduct world-class research in a lot of different areas: health, energy, food science, water. You name it, we do it. I was a governor before I was the secretary, and I think one of the reasons I was selected was because I've now amassed a lot of experience running large, complex institutions with lots of movable parts. DHS had 22 some odd agencies under its overall umbrella. The University of California is 10 universities. It's 6 medical schools. It's 5 hospitals. It's 3 of the national laboratories. So it too is this great big constellation with similar and yet dissimilar missions, all under one umbrella. So the ability, I guess, to figure out how to guide, create an overarching vision for what we're going to do, and then just manage all these varied pieces, I think is something that I come to the job with.
Here in Washington, there's a lot of talk about the effect of the sequester, the federal automatic budget cuts, on university research. Many university groups are saying, hey, that sequester has really hurt our labs and it's hurting the American research enterprise. What can you tell us about sort of the effect of the sequester on UC so far as you can tell?
Research was postponed, delayed, and I'm talking research that has applicability to curing diseases, to treating chronic conditions, to preventing disease, to energy sustainability, water sustainability, big issues for our country, either delayed, postponed indefinitely. It meant that we didn't open as many labs for young, rising researchers. That meant they couldn't employ as many graduate students and undergrads in the lab and give more and more students a laboratory experience, which is very important in this day and age. It was really just terrible in terms of the long-term health of the United States not to properly fund the research enterprise that's part of public research universities.
This summer, President Obama made an interesting suggestion for what the federal government should do as it looks at universities. In order to make higher education more affordable and improve access, he wants the federal government to rate universities for the first time on various criteria, including the percentage of low-income students they serve, perhaps the jobs and salaries that they get after graduation, or whether they go on to PhD programs and so forth. I wonder what you think of this idea of rating universities and colleges.
Well, I think from a public university standpoint, all that information is already out there, and we are very accountable to the students, to their parents, to the legislature, you should see the paperwork for accountability that goes along with federal research dollars. So in terms of that, and in terms of, for example, the incredible social mobility that is embodied in the University of California, where 40% of the students are Pell Grant eligible, where any student who comes from a family that makes less than $80,000 a year pays no tuition. So on the kinds of things the president is mentioning, the University of California would do very well. And we would also, that information for us is already available. I am skeptical about so-called rating systems in general, because I don't know how you craft them in such a way that they actually are useful and aren't themselves somewhat misleading.